Hello everyone, my name is Dr. Dhanashree Peddawad. I am consultant neurologist. I am working in Medicover Hospital, Pune. Today I will be talking about migraine. So what is migraine? So it is a type of primary headache. Basically headaches are divided into two groups, primary and secondary. So in primary headache, what we see is there is no organic cause or there is no underlying cause for the headache. But in case of secondary headaches, patient will have structural causes like tumors or swelling or some kind of infection, or patient may have some systemic illness or some other comorbidity which is causing headache. So in that case, we call it as a secondary headache. Okay. So, but what we see is migraine. It is the commonest type of headache what we see in day-to-day practice. So what are the other types of primary headaches? Tension type headaches, cluster headache, all these are comes into the category of primary headache. But today we will be talking about how do you manage migraine. So basically migraine will cause some symptoms which we all are very much familiar with, like they can have one-sided headache. Sometimes the headache can involve whole of the head, nausea, vomiting. They can also have symptoms like visual spectra or some blurring of vision at times, and they can also have symptoms like tingling sensation on one side of the face and all. The headache is usually more prominent around the orbit and on one side of the head. So once you know that clinically it is fitting into a migraine, so how do you manage? So basically there are three important things which we should remember. One is identifying the triggers and trying to control as much as you can those triggers. Second thing is lifestyle modification, and third is medications. So identifying triggers means there are different types of triggers and different patient will have different types of triggers. Some patient will say that when he goes out in the sun or when he is exposed to bright light, the headache gets triggered, or sometimes the not having food on time or not sleeping well can trigger the headache. So you have to identify the triggers in these cases and trying to avoid as much as you can. Then the second category is lifestyle modification. So again it comes like the patient should sleep well, sleep on time, and the amount of sleep he is sleeping is very important, and when he is sleeping, the sleep deprivation, like usually we see nowadays late night you go to bed very late and then get up at late in the morning, so that can also trigger headache. The second thing is diet. So eating well, eating on time, not skipping the meal, especially the breakfast. All these things should be kept into mind. And the management of stress, physical and mental stress, you have to take care of that. So all these things comes into lifestyle modification. And third comes the medications. So depending on the severity, if patient is having very frequent episodes and very severe episodes, then I usually advise them to take prophylactic medication. Basically prophylactic medication, the patient needs to take them on daily basis, irrespective of the occurrence of the headache episodes. So even if the patient is not having headaches on certain days, the patient has to take those medications. And this will it will take some time, and the frequency and the severity of the headache episodes will gradually reduce once patient starts taking these prophylactic headache medications. Apart from these prophylactic headache medication, patient can also take as and when required medication to abort the acute episode of the headache. So these are different types of medications. So patient needs to be educated about what needs to be done, what needs to be avoided, all these things. And with the help of proper guidance, the productivity increases, the headache or the number of days where the patient is having headaches can be reduced. So it usually gets under control with managing everything like lifestyle and medication. So this is it. I hope it helped. And if there are any queries, you can always reach out to us.